The Minister of State for Health says the National Primary Healthcare Development Agency is working with development partners to address the infrastructural gaps of COVID-19 vaccine. Speaking at the Presidential Task Force briefing in Abuja, he said storage, supply and distribution were some of the measures evaluated. On the aviation sector, the minister reiterated the need to ensure strict enforcement of COVID-19 protocols.
In terms of vaccines, the lead agency, that's the National Primary Healthcare Development Agency, working with our stakeholders and partners, is currently assessing the infrastructural gaps in terms of logistics for cold chain maintenance, storage, supply, and distribution to ensure vaccine viability and reach all. We are also working with the Aviation Ministry to ensure strict enforcement of the COVID-19 protocols at the local and international wings of airports across the country, taking cognizance of the high transmissibility of the new strain of the virus already confirmed in some countries. Particular attention in this regard is therefore being focused on passengers arriving from the United Kingdom and South Africa. We appeal to all states to increase testing to enable us to know exactly where we are. This will enable us to put in place mitigating measures to check transmission and provide treatment for COVID-19 sick patients. We urge all those with COVID-19 evocative symptoms to report and get tested promptly. We acknowledge with thanks the provision of 100 cylinders of medical oxygen per day by a donor company for the needed support of patients in isolation and treatment centers at the Federal Capital Territory. It is important to state that the ultimate plan in terms of medical oxygen supply is based on systematic oxygen assessment and gaps identification in the country, bordering on severe disequilibrium, uneven storage stroke demand ratio, distribution logistics, challenges and equipment and plant dilapidation. Our oxygen availability intervention plan is targeted at immediate, medium, and long-term plans with special attention to the COVID-19 high-burden areas like the Federal Capital Territory, Lagos, and Kaduna. The various approved treatment centers have scaled up activities as directed, and quality of care continues to improve. A major factor contributing to the mortality of cases is the late presentation at the approved treatment centers. We therefore appeal to caregivers not to hold on to suspected cases who fit the case identification protocol for longer than necessary and refer promptly. This will greatly improve treatment outcomes and drive our case fatality rate further down.